Good morning. I'm coming to you live from Clark's Hub City Pharmacy. We are an independent pharmacy serving Lubbock and the surrounding area since 2017. My name is Katie. I'm our lead compounding technician. I have been a technician for about 15 years. I've been compounding for the last 8, and I've been with Clark's for the last 3. Last month we discussed compounding for women and the issues that we can treat for them. So this month we thought it would be appropriate to address common compounds that we see for men. Also because Father's Day is this Sunday, so get your presents for your dads. Okay, so men face a variety of health issues throughout their lives. The most common 3 that we see at the pharmacy is low testosterone, hair loss, and erectile dysfunction. Because all of these topics can be difficult to discuss or even perceived as embarrassing, a lot of men don't know how to start the conversation with their doctors. We do offer consultations here at the pharmacy at Clark's to discuss issues like these so that the patients know what to ask their doctor to ensure that these issues are not being caused by any underlying health concerns, and after your doctor verifies that you're healthy enough to take the medications to fix this, especially with erectile dysfunction medications, then we would discuss what products we would recommend for their unique needs, the patients. Starting off with the erectile dysfunction, since that is the one that people have the hardest time discussing, 52% of men experience erectile dysfunction at some stage in their life, and 70% of those are after the age of 70. So you are not alone. It happens to everybody. We do encourage this conversation because erectile dysfunction can cause a marked decrease in quality of life for not just the patients, but also their partners. And who needs it when you can treat it? There are numerous prescriptions that are available if the doctor does deem you healthy enough for intercourse. I think the main concern would, of course, be heart health for people of that older age limit. But the vast majority are not covered by insurance and can be extremely expensive. Also, what we've noticed is anything that's like off the shelf, like the injections and the topicals, tend to be a general one-size-fits-all dosaging and doesn't work for everybody, which is when compounded medications are probably going to be an alternative for you, because we can tailor those to a specific dosage, a specific application, like topical versus oral, and they tend to be a lot more affordable than what is available commercially. Most of what we do offer here are oral capsules. We do have troches if the issue is swallowing the capsules or tablets, and we also have rapid dissolve tablets, which help get into the bloodstream a lot faster. They do have similar dosing to commercial, say like Viagra and Cialis, but we do also offer combinations of the two. And we also have some that have additional supplements like arginine, for example. Those are just a little small list of what we do offer and what we see the most of. Low testosterone is another very popular issue that we treat here at Clark's. It can affect up to 4 to 5 million men, and 65% of those are over the age of 60. So age does have a big factor, but this doesn't mean that you can't have these issues at an earlier age. The 2 most common testosterones commercially available are going to be injections and topicals. So we're going to talk about the 2 and which ones would be most recommended for you. We do not compound injectables here because that is something that has to be done in a sterile lab. But we do offer topical testosterones that are a lot more affordable than what you can get, unless you're one of the very lucky ones that insurance will cover your testosterone. The injectable is going to be your least expensive option, especially if insurance is not paying for them. It converts testosterone, more testosterone to estradiol, which can be good for weight loss, heart health, and Alzheimer's prevention. Unlike topicals, there is not any risk for cross-contamination. That is a large risk for topical creams, which we'll get into when we're talking about the creams. You can get consistent, stable levels with the injectable testosterone, but that's only if you're using it daily. If you do only use it once a month or once a week, you are probably going to experience roller coaster testosterone levels, which can affect your moods. And what that kind of means is that the first day that you do your injection, you're going to see this huge increase, obviously, to your testosterone levels. But by the time you're due for your next one, you're going to see a huge dip also. So the easiest way to avoid that is to do daily injections. However, daily injections have their own little list of issues because it can be a pain in the butt to inject something every single day. And you can also develop scar tissue on your injection sites if you're using it over a long period of time, which if you're using it daily is a long period of time. The other thing we did want to discuss on the injection that you should be told when you pick up your injection. If you're using another pharmacy, you may not have been, but you do want to use 2 separate needles when you're injecting. You want to use one to draw the testosterone up and then one to inject. Most of them you're going to get, most of these syringes that you should get to inject testosterone should have a lure lock tip, so you should be able to just unscrew and cap your used needles, and you should be able to trade them out fairly easily. If this is not something that your pharmacy offers, we do also sell these separately, but your pharmacy should sell these, and that's just, you can take it off, throw it away, put these in a sharps container. But yes, that is the best way to get your consistent levels with the injectable testosterone. Injections also don't affect good cholesterol levels, which the creams do. So the injectable is going to be the least expensive option. You can get consistent levels if you're doing daily injections, and it also does convert more testosterone to estradiol, which is good for the people who are needing that for weight loss, cardio health, and Alzheimer's prevention. Now we're going to get into the topical creams for testosterone. Once again, those are available commercially, some of them. Most of them are not going to be covered by insurance. That would be when I would recommend doing when we would recommend doing a compound, because those are going to be a little bit more affordable. When you're using the creams, they do absorb more of the DHT than the injection, which is good for erectile strength and overall function. So that is something, if you are using testosterone specifically for erectile dysfunction, you're going to want to use the creams. There is no risk of scar tissue because you're not doing any injections. It is much faster and pain-free. The daily applications mimic normal testosterone levels, so you're less likely to have that roller coaster effect that you would be if you're doing weekly injections of the testosterone. And the absorption is actually really great. They do sometimes see absorption rates go down, but there's been a couple of studies that they've done recently. I think it was on Wiley.com that they recommend applying the testosterone directly to the scrotum for the best results of absorption. And when you do that, you get very consistent levels. Most of the time they're going to recommend either between on the inner thighs or directly to the scrotum for this reason. If you are going to do that though, I highly recommend looking into this. You're going to want to check the ingredients on the cream to make sure that it's not made with alcohol, because if you're applying that to the scrotum, it can burn or irritate, and it's just not good overall for sensitive skin health. We do not make our testosterones with alcohol, so that is yay for us. So if you are using a topical testosterone cream and you have been using it scrotally and you have noticed some irritation, that might be a reason to try something different and change to maybe a compounded version. Topical creams have also been shown to positively affect the good cholesterol levels. which is also helpful for patients concerned with their heart health. Because most creams are recommended to be applied twice daily, the only downside there is that it makes it very easy to miss a dose. And if you are not applying the cream scrotally, you do risk, some people just use it on like their shoulder blades or their arms. You do risk cross-contamination with your partner, your children, your pets, because it'll come off either skin-to-skin contact or like on your clothes or on your bed sheets. So if you're not using it scrotally, we do recommend being very, very careful about cross-contamination, especially if your partner is trying to have a baby. But that is definitely something that we would recommend calling and discussing with the pharmacist or your doctor. The last thing we wanted to discuss was going to be hair loss, which does mostly affect men, but can also affect women. It is considered to be more of a cosmetic issue. So once again, most of the therapies are not going to be covered. Most of the commercial therapies that are available are not going to be covered by insurance. Let's see. Yeah, so about 80 million people in the US last year were suffering from hair loss. 2/3 of those 80 million people saw hair loss by the age of 35, and half of those were women. So it's not just men who suffer from this. It can be caused by a ton of factors, mostly hormonal fluctuations or genetics. Traditional hair transplants can cost anywhere from about $4,000 all the way up to $20,000. Again, insurance does not cover these, which is why you probably are going to try a over-the-counter or prescription alternative before doing these. You can get over-the-counter products, for example, like Rogaine and all of its generics. However, they can cost about $20 per ounce, which an ounce is 30 mLs, and that's about a tablespoon. And if you're using it long term, which you do have to for most of these products, it really adds up. We do compound similar alternative to Rogaine, and we do have combination formulas that contain like finasteride, biotin, EGCG, niacinamide, and others. So if you are suffering from hair loss, you have tried over-the-counter Rogaine, before you look into a hair transplant, we would recommend talking to your doctor about maybe any alternatives that we could make for you that might save you that $20,000. I think that was everything we had to talk about today. We are going to keep on with our lives. I don't know if we've decided on a topic for next month. We got caught up in a little bit of inventory and got a new piece of equipment, so we slacked a little bit there. Oh, I do want to mention that we do have our Sigvaris stockings on a discount, 20% discount on all of our Sigvaris stockings here in the store. We do offer free measurements to make sure that you are getting the proper size of compression stockings. So that's going to help give you the best benefit. That's just kind of for anybody who's traveling either by car or by plane. Anybody who's pregnant, especially during the summer, you can swell up so much. And anybody with like diabetes or anything like that, this can be a really difficult time for anybody who does have a lot of swelling. And so we just recommend you coming in, getting measured, and seeing what we can offer as far as compression stockings. All right, y'all have a good day.